Tracey Oakman, Director of Public Health. Does that work? Alright. Thank you. Alright, good morning everyone, thanks for coming. So just a brief update today on the number of cases that we have currently in Murrumbidgee Local Health District. We still have the three in Albury, and then we have seven now in our young cluster. So those cases, there are 5 in the hospital, and others are isolating in their home, being cared for by our virtual care teams, and the Albury team. The Albury cases are being cared for by the Albury Wodonga Health virtual care team. And so we've also had detections in the sewage over the week in Albury, in Griffith and in Young, and so Griffith is the area where there's actually no known cases, so that's of particular concern for us, and we'll encourage everyone in the region to get tested for COVID. If you have any symptoms at all, please.
Clarify the 3 cases, or give us a little bit of detail about
Yes,
what
certainly.
we're talking about.
Certainly, I can tell you some of the things, and then I can hand over to Michael to talk about the care for those people, if you like. So, the person at Benton Mildura, he lives in. He's a truck driver and he lives in our region, or in Albury region, and the other case was outside of, had been outside of our region where he contracted it and brought it to us. The third case was a close contact of that case. So those 3 people are currently being cared for by Albury Wodonga Health. If you'd like to speak.
Give me 1 second. Okay.
Yeah, so the 3 cases that Tracey's referred to in Albury, one of them, as mentioned, was a case that was transferred from Mildura. He's actually now been transferred to Melbourne and isn't being treated locally. He was admitted to hospital, Albury-based hospital last week, and as per the protocol, he was sent down for further treatment in Melbourne. The other 2, as Tracey mentioned, are related to each other in terms of one being the primary case that contracted COVID outside of Albury and travelled here and had a close contact with the other positive case. They're currently being cared for in the community in accommodation, and we're currently looking after them.
Michael, is it true that one of the people being treated has been, quote, uncooperative with Albury Wodonga Health?
Certainly they've been cooperative. There are some challenges in terms of just communication with one of the particular cases, but we're working as closely as we can with them to make sure that they're cared for appropriately, and of course with Murrumbidgee to do the appropriate contact tracing so we can identify exactly where that case has actually been.
Can you tell us in what way this person has been uncooperative?
Oh, look, all I can say is that there are some limitations in terms of his literacy skills and his ability to sort of communicate and tell us exactly what's happened in the normal way. Certainly there's no issue with him working with us. It's just really getting a sense of where he's been and when he was there.
When do you think you might have a sense of potential exposure sites from those 2 cases?
Look, Murrumbidgee really is looking after that contact tracing and working through that. There's been a number of sites declared already, which you're aware of, and that process will continue with the contact tracing process, I assume.
Do you know what the status is of that truck driver who's now in Melbourne in terms of his health?
No, I don't know. But again, we'll be notified when he'll be transferred back to Albury, and so we can provide the care for him when he returns. But at this stage, we have no further updates about his status at this stage.
Michael, a number of patients in Wodonga are being treated in Wodonga Hospital. Is that something that Albury will do in the future, treat its COVID patients here in Albury instead of sending them off to Melbourne?
So the protocol for Victoria is slightly different, I think, to New South Wales. If we do get Albury Wodonga Health has not been identified as a COVID hospital. Those COVID hospitals are effectively in Melbourne. So what happens is a patient, if they require inpatient care, will be transferred to us. We'll stabilise them, we'll isolate them, and then we'll transfer them to Melbourne. So the idea is that we don't treat positive COVID cases here, except to ensure that they're safe before they're able to be transferred to Melbourne.
What's the reasoning behind that? Is there anything that could be done for Wodonga held to be a COVID hospital?
Oh, look, it's really about just protocols to ensure the safety and that if there are positive COVID patients, they're cohorted together and the specialist treatment they require is delivered. We certainly are capable, of course, of managing COVID cases locally, but across the state, the decision has been made for a number of hospitals in Melbourne, not all of them, that they will be the COVID streaming sites, and they're prepared in terms of the way they've set up their structures, wards, etc. down there to isolate and deal with those COVID cohorts directly.
So it's not a case of a lack of services or a lack of ICU as we're sort of at this stage?
No, and indeed we obviously prepare in case Melbourne is overwhelmed. We can't actually take COVID patients to treat COVID patients here. So that's part of our contingency planning. We're absolutely capable of doing that. Some of our infrastructure, of course, as you're probably well aware, is ageing. So there are some workarounds we have to put in place in terms of how we cohort and separate patients, which we're doing that. But as I say, hopefully we'll never get to the stage where we have such an overwhelmed number of positive people that they can't be dealt with in Melbourne.
Michael, is it true that one of the people being treated for COVID is Aboriginal? And I mention this only because they are an at-risk group. Is that true? And does this person have 5 children that you think are at risk?
Look, I can't go into the specific details of each patient. Obviously, I need to protect their privacy. Obviously, the Aboriginal community is an at-risk community generally. We are working hard, again, with Murrumbidgee to ensure that the Aboriginal community is being vaccinated and that we are ramping up our testing for that community. So it is really important that the Aboriginal community does make sure they do get vaccinated. There was some pop-up clinics on the weekend that were run specifically for our Indigenous community, which were quite successful. We do encourage anybody, not just Indigenous people of course, but to come and get tested if they've got symptoms.
In between these Albury exposure sites and what's sort of come out in the northeast, how many people have you contacted or identified as being casual or close contact?
Look, again, I can only speak for south of the river, of course, where our PHU, Primary Health Care Unit, does a contact tracing. The specific numbers I can't tell you. There's been a number of sites across northeast Victoria. We've now completed almost all of the contact tracing for that. That's been a really good effort. And at this stage, sites remain fairly low risk in terms of potential exposure.
So you're not expecting cases to be emerging in Wangaratta or even in Albury more?
Look, again, we're on high alert on both sides of the river. I think the Victorian contacts have been a lower risk than Albury, but again, you never know. We need to be vigilant. We are carrying out our contact tracing, as I said, and we do encourage people again to get tested, get vaccinated. On the north side of the river, again, Tracey probably has a better view of that, but we are on certainly raised alert. It is concerning about the positive cases we have had in Albury, and we're just, as I say, making sure we have preparations in place to deal with what might come out of that.
Were there any further questions for Michael before handing over to Tracey? So Michael can speak on vaccinations.
I just had a vaccination question. Is it for Lucie or for Michael?
Either or from Albury.
Do you mind if I grab Lucie just for another talent, as we say? this is for Sarah.
We did just have some record days in
I saw
vaccination
that.
last
I saw
week.
That.
Yeah.
That's what I wanted to get a grab about. Sure. Lucie. I understand that you've had some record days for vaccinations and that you've hit the 50,000 milestone, including 4,000 alone last week. Albury Wodonga Health will be fairly happy about those numbers.
We're thrilled to see the vaccination numbers that we saw last week. There was certainly a huge surge in response to vaccination, and we have delivered well over 50,000 vaccines out of the Wodonga hub just since the beginning of the program. And last week we had a record day on Wednesday with over 1,000 vaccines delivered across Albury Wodonga alone, and there were more than 4,000 vaccines delivered across Albury Wodonga last week, and more than 6,000 delivered across the network, so our network extending through to Corryong and Bright and Wangaratta, etc.
I might ask a couple of vaccine things. Yeah. The Premier of Victoria was talking today about some problems with
had really good delivery of vaccines over the last couple of weeks, and we know that we're well set up for the coming weeks.
And is childhood vaccination happening?
12 years and up, so anyone aged 12 years and above can access a vaccine at our state-run hub in High Street in Wodonga or through the network that we deliver across northeast Victoria. There's also good availability at GPs and pharmacies. I think increasing number of pharmacies will come online soon as well.
And Albury Wodonga Health has been advertising online about looking for staff for vaccination and for contact tracing. Is there any capacity issue? Do you not have enough staff, or is that about expanding for the future?
It's about expanding for future needs. So there is really a push on at the moment to get as many people vaccinated as possible, and also planning for should we see increased cases and we need to expand our contact tracing capability and our testing capability, that we've got a surge workforce available to turn on quickly so that we can respond to the community need.
So at the moment there wouldn't be enough staff to accommodate the surge if there was a surge in cases?
We can certainly accommodate a surge at the moment. We've done this on and off over the last 18 months, particularly at times when the borders closed, etc. We've been able to stand up extra teams. But we know there's a strong interest, and with the expanded endorsed workforce for vaccination testing that's been endorsed through the state government of Victoria, we're really keen to give people who might be interested in coming forth and helping out with the public health response an opportunity.
I guess just with the contact tracing that you guys do, are you confident that the work that you've done so far nothing else will be revealed? That no, this is it. 3 cases.
Look, I can never say this is it. Obviously, where we have identified contacts, they're in isolation, and it just depends on whether they will become positive later on themselves as well. So I think there's every opportunity that we talk to our clients. They may remember new things. At the moment, we think we've exhausted the conversation, but like yourselves, everyone's human. We think, oh, I forgot I did that. So there is possibilities that people will remember something they did that they didn't remember when they were talking to us the first time. So it's never over, but at the moment, I think we've probably exhausted our conversation there.
So we have the case that came on the XBT. This third case is a contact of theirs. Is it that third case that's related to the Coles Lavington exposure site, or where does that fit in?
Look, the person came on a train, not the XBT. It was a train, no.
Sorry.
And it is related to a contact of that person through a residential contact. That was it, yes.
Yeah, just on that question that we had from Michael about how many people you've contacted as potential, do you have a rough number?
It's really hard to give you identification on contact tracing, the number of close contacts, because many of those are done through protocols, through the ministry SMSing, through the QR code check-ins,
yeah,
and also through general media inquiries, so people are asked to self-isolate and so forth. And we don't know all of those people, so the actual numbers are really difficult to quantify, unfortunately.
That's fine.
Tracey, I had a few questions from our Wagga colleagues about the young outbreak.
Yes.
Is it clear yet where the young cluster originated? Have they been in a hotspot in Sydney?
No, we haven't been able to identify a source from the young outbreak at the moment. We're still looking into that.
Okay. And we know that 2 of the cases announced in Young are household contacts, but are they or the third case linked to the cluster or exposure sites in any way?
It appears that they are direct links, yes.
Okay. And wanted to know what the latest first dose vaccination stats are for Murrumbidgee staff. Do you have any of those?
I don't have the latest one. Do you have the latest data? It was doing really well, but I just don't have the actual figure today.
Okay,
Sorry.
that's totally fine. And are there concerns about local vaccination rates in any particular hospitals or paramedic units or anything like that?
Not at this point. We're well on track to meet the legislation at the end of this month.
Yeah, fantastic. And it seems generally back in Albury that, does it seem like a kind of optimistic mood at the moment? Only no cases the last 2 days, only 3 cases at this point?
I'd be optimistic in 14 days. I'm sorry, yeah. Look, we're living in an environment where there's cases, and there'll be more cases, and it will become our normal life. So I'm not going to make any crystal ball guesses.
Fair enough, absolutely fine.
Just a final point on that. Do you have a direct role in sort of talking to New South Wales Health about the decision to end on Thursday for a 7-day?
They certainly seek my advice my concerns in the area, but I don't have final. I'm not that
At this
powerful.
There's no indication this stage to them whether to extend or not.
No, I don't know. Yeah.
And it does, sorry, one more question for you, Tracey. This is for young and for everywhere, I suppose. There's been some anxiety about, like we were talking about, exposure sites not being uploaded, things like that, misinformation on Facebook. Is there a one-stop shop kind of place where people should be going for their information on exposure sites, things like that?
Look, generally exposure sites are on probably a couple of different places. New South Wales Health web page and also the local health district websites will have the most up-to-date information there. Yeah, and there is a lot of rumours, like you said, unfortunately, we just have to do what we get through the interviews and put that up, and rumours will be rumours.
Are you concerned about the Facebook rumours? Do you take any steps to try and counteract those?
Look, we don't. There's too many of them, so it's just impossible. So we just ask people to look at a trusted source of truth, and Facebook is not that.
Absolutely. Great.
Oh, Tracey, sorry, I just have one more question if you don't mind, just from our Wodonga office, and my apologies, Catherine, if I'm repeating what you just said, but just on the cases in Young, can you tell us a little bit more how apparently they travelled to Sydney and back, and anything new you can provide in terms of how they're linked, how these 7 cases are linked to the cases that we know about?
Look, we actually don't know where they acquired their illness from. I have no information on them having travelled to, the ones we've interviewed to date have not travelled to Sydney, but we haven't quite worked out where the link is yet. So we haven't got the genotyping back that allows us to definitely link it to a particular cluster, whether that be the ACT cluster or the Sydney cluster. So at the moment we haven't received that information back to know how they link in through the clinical testing or genomic testing, and our interviews haven't revealed ground zero yet.
Thank you very much.